Hi doctors, I'm Dr. Gagandeep Gauba. I am a practicing dental surgeon and oral implantologist. Today we will be talking about lingual cortical engagement, which is a technique used in basal implantology. And for this, we will be taking help of this model right here. Okay, I hope everyone can see the model. So for learning lingual cortical engagement, first we will have to know about the mylohyoid ridge. So like in this model we can see this protuberance is the mylohyoid ridge. This bony prominence is the mylohyoid ridge. Okay, everyone be able to see that, right? Okay, so in which region it is seen? So it is seen primarily in the mandibular first molars distal root. Okay, its prominence is from mandibular first molars distal root, right? Distal root posteriorly onwards, the mylohyoid ridge is prominent. So, okay, so in lingual cortical engagement, what we do is we buccally penetrate. Okay, we start the osteotomy from this side buccally, and we place a finger on the lingual side just below the mylohyoid ridge, right? And then we start drilling and pointing the drill, aiming the drill towards our finger that is just below the mylohyoid ridge. The rationale behind this is that our nerve, the mandibular nerve, it always runs below the mylohyoid ridge. Okay, so what we'll be doing is we will start the osteotomy, slide buccal. We will first place the finger on the lingual side just below the mylohyoid ridge, and then we will place our drill buccally. Okay, we will place our few millimeters buccally from the crest, right? And we will aim the tip of the drill towards our finger. Okay, let me increase the speed. Okay, the speed is now increased. So yeah, so what I'm doing, I'm drilling the first cortex now. The first cortex is drilled. Now the bone becomes soft and I'm entering the cancellous bone. Okay, now I am able to feel the second cortex, right? So I will stop my drill just when I feel the tip of my drill touching my finger. Okay, now the tip of the drill is, I am able to feel the tip of the drill, right? Everyone can see this. Okay, so I am just perforated and I don't have to go beyond that. Once the tip of the I feel the tip of the drill, I will take my implant and start tightening the implant in the osteotomy site. Okay, and when I will stop when I feel the tip of the implant emerging from the just below the mylohyoid ridge. Okay, everyone can see the implant is now coming out of this area. There actually, this is a plastic model, so the plastic is stuck there, but okay, now we are able to see, right? Okay, the tip has just emerged just below the mylohyoid ridge. Now I have engaged the lingual cortex. Now what will we do? The angulation is not prosthetically correct. So to correct the angulation, what we will do, we will be bending the implant. And how we will bend the implant? We will bend the implant with the help of a driver or a torque ratchet. Okay, then we will bend the implant in the prosthetically correct position. Now the implant, as you may see, the implant is in prosthetically correct position. We may bend it a little further. Okay, now it's properly vertical and properly perpendicular to the ridge. Now we are seeing that I have engaged the lingual cortical and torqued the implant right here and then bend the implant to get it into correct position. So this is how we do lingual cortical engagement in the mandibular molars. So this technique is primarily used to replace the mandibular molars. Okay, first and second molar, primarily the first molars. So this technique can be used as standalone technique like replacing a single teeth or segmental replacement, or even in case of full mouth rehabilitations, we can place two lingual cortical engaged implants on the right side, two lingual cortically engaged implants on the left side. Okay, this is how we do full mouth rehabilitation in basal implants. Thank you. And this is how we do lingual cortical engagement in basal implants.